There's no really clear-cut difference between STDs and STI. It's like an old name and a new name. STDs used to be a collection of infections that are sexually transmitted, and the new teaching and the new modalities now refer to it as sexually transmitted infections, so that we can be clear as to identifying which particular organism is causing which infection, and that would also enable the treatment modalities to also be clear. So that goes a long way in helping to identify the exact infection and the exact management options. So there's no clear difference between STDs and STI. And talking about toilet infections, I think more people who try, well, in this climate and from experience, more people who try to hide away from identifying with the fact that they are sexually active always call every infection toilet infection. And the way to know the difference is to find out the exact organism that is likely causing that infection. That being said, more urinary tract infections would be what people should be referring to as toilet infections. Although this has nothing to do with sharing toilets and all those other myths that we're aware of. You know, it has to come from down up or from up down. So the STDs are different from urinary tract infections, which I think is what we commonly refer to as toilet infections in this climate. Research shows that women are at a higher risk of contracting STIs. But that's not even the worst part. The worst part is that when it is left untreated, women have a higher risk of developing secondary level or tertiary level diseases from sexually transmitted infection. And the reasons are obvious. Men have a phallus, which is covered, protected, and can be kept clean. But women have a narrow pathway, which is the vagina, which is always moist and can also house so many types of infections. So the effect of it remaining untreated is actually more of a disaster in women. So that's why it needs to be identified and it needs to be treated immediately. Yes, it can be transmitted through oral sex. We all agree that the gut is the dirtiest part of the human body. If you've been part of anatomy, you'd see that whenever we get to the gut, you know, the smell that comes out is not always nice. Where is the entrance into the gut? It's the mouth. So the mouth is usually not as clean as we think it is. So since the mouth, the lips, the tongues are part of the tools that we use for oral sex, it also serves as a base for transmission of STIs. So oral sex can transmit STIs. Now, in developed climes, what they teach is that you could use barrier methods if you have to perform oral sex, which means you could use a condom to still perform oral sex for both male and the females. So the use of a barrier can reduce chances of transmission of STIs. But going bare has its own risk. A number of diseases share symptoms. You know, it's really not very clear, you know, distinction between even UTIs and STIs. So the way to know is to get expert intervention, which means you have to get a medical test done. You know, you have to get a high vaginal swab done. It could be an endocervical swab test done. It could also be a urine microscope culture and sensitivity test to be able to identify if what you have is really an STI or not. So the clarifications are not visible to the eyes, but they are very clear once they are being investigated and they are being looked at under the microscope in a microbiology lab. A high white blood cell count doesn't mean you have an STI, but if you have an STI, you could have a high white blood cell count. A high white blood cell count just prompts the doctor who's managing to know that there's an infection going on. You know, it's like you have more security all of a sudden. Why? You must be under threat. You know, so that's what the WC, white blood cells serve in the body. So when we see them in high numbers, it points us in the direction that, look, there's something going on here. So if you have a sexually transmitted infection that is ongoing, chances are that your white blood cells will be high. And with every other infection that you have, chances are that your white blood cell will be high. Like I said, with oral sex, the barrier method goes a long way in protecting STDs. So the use of condoms goes a very, very long way, safe sex and promoting the reduction of STIs. The truth is that not everybody is having unsafe sex. Some people have never had sex without condoms. Because if we're all having sex without condoms, the rate of STIs that would be available now will be the highest in the world based on our population. So people should not be deceived. Not everybody is doing it. Not everybody is even having sex. But if you have to have sex, you must use a condom. The dangers are just too many. These STI infections that we're talking about, some of them can be contacted and be cured over a short period of time. Some of them take a very long period of time. Some of these STIs also go to a higher level and cause other damages, in the body, and this just makes the whole thing quite clumsy, So not everybody is having unsafe sex. So women, particularly young women who are unmarried, should protect themselves by either staying away or by using condoms to be able to reduce chances of contraction. We need to pray. Well, it's a moving trend. There's almost nothing you can do about it, apart from doing the right thing. So it's not a medical intervention that will actually solve that problem. It's a social intervention that will solve that problem. So how do you make an unfaithful partner faithful? You understand? So there has to be some teachings. There has to be more level of understanding. There has to be a higher level of communication between both partners, because it's really, really big business. It's really, really big business. And you're just one person away from the most dangerous thing in the world. So it just makes a lot of sense to be faithful. There's nothing teachings and communications cannot solve. And you must identify the problem. Okay, this would be my take. If you shave and you break your skin and you have bumps that are open, you can house organisms that cause STIs, and you can also transmit STIs. So I don't know about not shaving, but if you shave and you have breakages, it's advisable to not have intercourse at that time, and these things heal very, very quickly. It's like just saying that we shave the hair under our arms. The same day you shave, I'm sure you don't use your antiperspirants because the skin is broken, the skin is open. So on days where we shave, we could wait like 1 or 2 days, and we will be fine. But it's not that whether you shave or you don't shave. It's when you have breakages on the skin that you're likely to be prone to having challenges of contractions of STIs. Well, in some cases we have infections that are resistant to treatment, but the most common thing we've seen in experience, particularly because I work in the laboratory and diagnostic space, is that most people just go ahead and treat. They don't test before they treat. And if you're wearing the wrong dress for the wrong occasion all the time, you would always appear wrong at the right occasion, if that's a good example. So what it is that people should test before they treat. And if it's STIs, we advise that you also bring your partners forward to get tested and treated. Because if you keep treating and you keep going back to your partner who's not treating, it's like you get saved from an accident and you're going to stand in the way of another accident. And you have to keep going to stand in the way of another accident. So my advice is that you need to test before you treat. There's some antibiotics that would not work for some particular types of infection, and there are some antibiotics that would work for some. So if you test, and that's how we call it an MCS. An MCS test, it could be high vaginal, it could be endocervical, it could be urinary. Is that it's we first of all look at it under the microscope to be able to see what organisms we're actually toiling with. Then we culture this organism, which means that we feed the organism to make it multiply. This is done in the lab anyway by professionals. So when we now have a higher quantity, we now start to inoculate them with different types of drugs. So whichever drug we find to be most effective in trying to destroy a cultured organism that was identified becomes the drug of choice. And the MCS test is microscopy, culture, and sensitivity. Microscopy is that after we prepare our slides from your samples, we take a look at it under the microscope and we're able to tell what it is likely to be. Then we go ahead to culture it. Then we start inoculating it with a sensitivity test to be able to see which exact antibiotic works for the exact infection, or the exact organism that we must have found. So that makes testing very, very important before you treat. Otherwise, you just keep treating, and you keep saying that the infection is not going away. And like I mentioned earlier, if you treat excellently and you expose the gain to the same partner who's infecting you, and this could be male or female, so you have to be on the right side of the law. And lately, there's been loads of campaigns about cervical cancer screening. Cervical cancer is the second commonest cancer in women, and it's a sexually transmitted infection. That's the cause, and it's a viral infection. It's known as the HPV, the human papillomavirus. Now, if you're having the same symptoms of vaginal discharge, pain during urination, lower abdominal pain, weakness, fever, and all those other things, and you go up taking antibiotics, you just might be on your way to having cancer. So don't play doctor with the reproductive organ. It's the most important part of human beings, Yes, repeated STIs, untreated STIs, long-lasting STIs could make it difficult for conception to take place, because conception actually takes place in a specific environment, in a specific mode, under specific terms, under specific temperatures, under specific levels of hygiene. It just has to do with so many things. That's why when men do seminal fluid analysis, we look at the morphology, we look at the motility, we look at the speed. If all these things don't add up, they would form a barrier to allowing conception to take place. And this is also one of the biggest problems that we're having now. So we like to take care of things like infection. Those are primary level care that can be taken care of, and that can be taken out of the way. And that way we're able to get to our destination, and we're able to do what we are supposed to do. So yes, untreated STIs, long-lasting STIs, unidentified STIs also play a role in causing infertility in women. But once these are treated, it helps to get a better picture. And again, it's very important to treat your partner once a diagnosis of an STI or an STD has been reached by your doctor. It's very, very important. Femcare Diagnostics and Medical Services, it's a multidimensional laboratory and diagnostic center here in Abuja, and we offer a wide array of tests. We have a very functional microbiology department, and this is where most of these infectives and these infectious tests are tested, for us to be able to tell. We have a quite robust team that work in that department. We also have equipment that help us to get excellent results, because this is a very, very high specificity area of the practice of medicine. So almost all microbiology tests, including blood cultures, are available in Femcare Diagnostics and Medical Services. And these services are available everywhere, but it's just very important to make sure that you get this test done where the results will mean something to you. So don't just do it everywhere. Don't just do a wishy-washy magic, and you know what I'm talking about. We even have a profile, a complete profile for STIs for both male and female, to be able to ascertain that they're both clean and clear and good to go. So all these tests are available at Femcare Diagnostics and Medical Services. I don't know if your camera can catch the social media handles, so follow us, send us a DM, ask questions. There's always somebody nice on the handle to answer all those questions, so I'll be waiting to hear from you guys.